The federal government, the Prime Minister, has presented his plan for an increase in health funding. Not quite what the premiers were looking for. To dig a bit further into that, I'm joined by Premier of New Brunswick, Blaine Higgs. Premier, welcome back to the program.
Thank you. It's nice to be here.
Nice to have you. Listen, I want to start with just your reaction writ large. We heard from your colleagues there. I'm not sure we heard you chime in. So what do you think from New Brunswick's perspective of this offer, if we can call it that?
Well, certainly not quite what we expected. Could be a bit of an understatement. It was much less than we had asked for, much less than we'd hoped for. It wasn't really a negotiation. It was more like here's the funding model, and you can think about that and how that works for you. I do think that the items that were identified, as areas that we could have improvements, and what that might look like. There were different points made there, and I think that makes sense. I think we should have standards across the country that we can find ways to ensure that we have a healthcare system that works for everyone in any part of the country. That's all good. I also think the very insight of the federal government in saying, okay, well, this is all we're going to do this time, is basically suggesting we need to look long and hard at how we deliver healthcare in our country, and we need to look at what best practice exists not only in Canada but elsewhere in the world, and be innovative in our approach to change. And I think the public are ready for that because they want better healthcare. And so I think with this funding model that's so much lower than what we anticipated, we are actually in a position that we've got to do that.
I'm not quite sure I understand what you're getting at there, sir. Like, it seems like you're saying that we might have to do something dramatic. What is that thing? Is this like a greater role for the private sector, or?
I don't know what that looks like, but I think what it's saying is that we can't keep doing healthcare the way we always have done it and expect a better result. Because we have, put money into healthcare, more so than other departments for years and years and years. And yet the outcomes, certainly during COVID and challenged, are becoming increasingly more difficult to meet. And that's a lot to do with demographics, a lot to do with, people retiring and the workforce shortages. So I guess in looking at how we manage that going forward, it's what do we need to change? What models work best? How do we recruit more people in a meaningful way? We talked about that in the meeting. How do we bring in more from countries that are already certified and that could work in our country immediately rather than be 2 or 3 years getting up to speed? I think there's just a number of things that the pace has got to excel on our ability to change and deliver better results. Okay,
I do want to talk about looking forward in a moment, but that meeting behind closed doors, it's clear now, we've heard from you and some of your counterparts, underwhelmed. Did anyone express that to the Prime Minister? Was there an attempt to push back?
Well, I think the Prime Minister made it clear and that this was their position, and so it wasn't a negotiation in that meeting at all. And I won't say that we expected it to be, but now we regroup and as a COF team and decide, okay, well, what are our next steps, and what are we able to do with this? Speaking from an Atlantic region and certainly a demographic and an older population, there's some on the bilateral agreement and how we can work with that. There's some advantages there, or recognition of our situation in Atlantic Canada. That's certainly a positive, and I want to be, look at the brighter side on any of this. But maybe it's worth, as I say, reconsidering just how we deliver healthcare in many areas. But there wasn't a negotiation. There were just clarification points that were asked, and we all asked those, just so that we have more insight into what the offer really meant.
Okay, so is the takeaway then for folks in your own province that you don't expect that there's a way to make this number any bigger when it comes to the needs of New Brunswick? If you are discussing with the federal government, it's going to be working out the specifics of that bilateral agreement. But it sounds like you're not expecting that you can push back all that much.
Well, I mean, obviously that's a collective decision with all of my colleagues, and that's what'll come from our meeting on Friday. But I don't know how many you spoke to, but I don't think you probably got a lot of optimism that there would be another number that we could push back on. But I'm sure it'll be a topic of discussion on later in the week or early next week.
And are you concerned about keeping a united front? Because I did hear from the comments of some of your colleagues there, some of them seem more ready to sort of roll ahead with this, right? Some money's better than no money. We're happy that we're having this conversation. Are you concerned that some folks may be pretty quick to just get the financial taps turned on.
Well, I think we all look at it in that fashion, is that it's better than no increase at all. And get on with the bilateral discussions and see where that takes us. So yeah, I mean, I have to be in that camp too, that I think that there's an opportunity here to really work and move forward. And then there's an opportunity to work on the bigger items like immigration, like the technology and electronic records and sharing that all over the country. So we really have an integrated system that we can be state of the art in Canada, not necessarily in any one spot, but in the entire country.
Premier Legault talked about this plan as being a starting point, a down payment for further discussions. It took you 2 years to get here. Do you think it's realistic to think that this is just a down payment?
Well, I think the dollar amount we consider a down payment, and I have to agree with Premier Legault on that. But the timeline in which we might see a change, I don't think I'd hold my breath on that. And we basically would be, maybe we're always talking about increase in health transfers, but nevertheless, we have what we have. We've got to find a way to work with that. And I hope the population understand that our collective goal, working through with health authorities and health professionals, it's to serve the customer better, and the customers are the people of our respective provinces. And how do we best do that with what we have to work with?
I appreciate that there's, as you say, discussion Friday or early next week to come. There's obviously going to be conversations with the federal government, federal officials over these bilateral agreements. But can you say anything about how long you think this process is going to take? If the number's not going to change all that much, are we months away, weeks away, do you think, from seeing some actual deals signed?
Well, we obviously want the federal budget to contain, the increases, so we don't want to have that be delayed. I think the bilateral agreements will be months. I mean, I say weeks to months, but not more than a couple of months type of thing, maybe 3 months. But I would like to think by the end of the first quarter of this year, we would be well along, if not have concluded a bilateral agreement.
In closing, I'd just like to ask you what your message is to Canadians who have been hearing some very unsettling, very sad stories about particular instances, be it in their emergency rooms or whatnot. They've been told that their healthcare system is broken. Given what we now know today, what would you say to Canadians about efforts to improve that healthcare system?
Well, I think there's a lot of collective efforts happening, and yes, our healthcare system is challenged. We know that, and we come out of COVID, as a nation, not unscathed. We certainly saw the challenges and the stresses, and we're trying to rebound from that. I can go on to different areas and meeting with different professionals about things we can change in the system to make it better for people that are needing the system. The collaborative care model with community care centers as opposed to individual doctor practices. All these things now are starting to come to fruition, and I can speak to that in my own province. But I think people are expecting better healthcare results. And I think the Prime Minister, stuck to that these are areas of improvement that are required. We want you to tell us how you're going to improve in those areas. I think the public deserve to know that, and certainly that would be my goal, is that, and we are measuring that. So I'm very prepared to release that information. And actually, we're doing it in areas that, cataract surgery, hip and knee surgery, getting to the national standard or beyond. I'm kind of excited about some of the trends I'm starting to see. And everyone needs to be engaged in that solution, and I think we're going to see the rebound here. Okay.
It certainly doesn't sound like there's been much objection to any of the conditions or the asks of the federal government on that front, even if there's concern about the bigger deal. Listen, Premier Blaine Higgs, appreciate your time today. Thanks very much.
You're very welcome. Take care.
Now the Prime Minister has presented a new health care funding plan to the country's premiers, a 10-year deal with $46 billion in new spending. But does it meet the bar for the provinces and territories? Why don't we ask one of those jurisdictions? Joining me now, the Premier of the Northwest Territories, Caroline Cochrane. Welcome back to the program, Premier.
Thank you. Glad to be here.
Happy to have you. Listen, I want to start by asking you, I guess, your overall reaction to the deal. We know some of your colleagues sound disappointed. In fact, they've used exactly those words. What do you think?
Well, I think it's important to recognize, first of all, that the federal government has finally come to the table. It's been a number of years that we've been asking to meet. We can't do this alone, especially in the territories. We're very reliant on federal support. We're a large landmass with a very small population, so we're very dependent on the supports that we can get from the federal government. So I am optimistic that there will be funding coming through the bilateral agreements to the territories. I'm really glad that it wasn't all per capita. The CHT money will be per capita, but the bilaterals is not going to be. I'm also respectful that he's increasing our Territorial Health Initiative funding, and I'm excited that he's actually looking at the Indigenous government stream as well. I think that's what I would lobby for.
I do want to dig into the Indigenous portion of this in a minute, but I just want to ask you first. Your colleagues earlier were talking about the importance of a united front, but if I listen to what you just told me, you sound like somebody who's pretty ready to sign a deal, are you not?
Oh, I think that in all of us, it was just presented us this afternoon. There was a lot of figures. Our officials are scrambling right now at this point to actualize what that means for the Northwest Territories. So I would be foolish to sign any deal until I was really, till it was comprehensive in what we're actually getting out of this.
Given what you were asking for versus what has been presented to you, do you think that this is a fair offer?
Again, I think it's important that premiers, we work together. During the COVID times, we stuck together with the federal government, and there is a benefit to doing that. All Canadians, they don't want us to be divided. They want us to work together. So as I said earlier, the CHT monies that the premiers have concerns about does not impact the territories as much as other jurisdictions. That funding is based on per capita. We're 45,000 people. It's not going to impact us. Where we're looking at the needs, our healthcare needs being met in the Northwest Territories are through the bilaterals. So we're in a little bit different position than the bigger jurisdictions in the South.
Okay, let's talk a little bit about the money that is specifically dedicated to Indigenous peoples. As part of this plan, $2 billion over 10 years to address the unique challenges Indigenous peoples face when it comes to fair and equitable access to health care. What are your questions about how that's going to interact with the situation in your territory?
Over half of our population are Indigenous in the Northwest Territories, and so that is one of the areas that I do have a lot of questions for the federal government. A lot of times when the federal government gives money for Indigenous streams, it goes to Indigenous people on reserves, which in fairness are very needy as well, especially when it comes to health care. But the Northwest Territories is often left out of that formula. We only have 1.5 reserves, 2 reserves in the Northwest Territories, but we have like 15 Indigenous governments. So it was one of the first questions I asked in the meeting with our Prime Minister is, will you consider the on-reserve and off-reserve? Because I want to make sure that all Indigenous governments actually have access to that stream. There's no Indigenous government that isn't struggling with their healthcare needs for their people. So it would be inappropriate, in my opinion, to only allocate it to on-reserves and then exclude the people in the North. That would not be okay. The North has struggled a lot for very long. The federal government recognized that. They've done an Arctic and Northern Policy Framework. So I'm hoping that they'll take that into consideration.
There was a point that made by many of your colleagues, about 2.5 years of build up to a 2.5-hour meeting. What was it actually like in that room? I mean, was this tense? Was it collaborative? What did it feel like when everybody was finally around the table?
I would not say it was tense at all. I think that everyone was very respectful. The Prime Minister, the federal ministers, and the premiers around the table. I think in fairness, all of us had questions. It was a proposal that was kind of dropped on us, and we were scrambling to make sense of it. So there were valid questions asked around the table, myself included, around the Indigenous stream, around the northern funding for the Northwest Territories. But I would say that no one at any point was inappropriate, was aggressive. I think we were all responsible.
Okay, just in closing, Premier, how quickly could you see yourself actually signing a deal with the federal government on this?
Well, like I said, our officials are trying to analyze it right now, what that means for the Northwest Territories. I'm also the chair for the Northern Premiers, and so I'll be working with the Northern colleagues from the Yukon and Nunavut to make sure that all of our needs are met. And I believe that we're going to be meeting with the Council of Federation within the next couple of days. So hopefully after that meeting, we'll know where we stand.
Well, listen, we appreciate you letting us know where you stand, Premier. Appreciate your time today. Thank you very much, Premier of the Northwest Territories, Caroline Cochrane.